Welcome, everybody, to the QMC Board and Collar podcast. Stephenie, Monica, and I are thrilled today to get the opportunity to host this leadership roundtable with our guest from HealthNet Aeromedical Services. I'm Kandi Sigona, Chief Revenue Officer for QMC, and my co-hosts are Stephenie Tollett, our VP of Client Operations, and Monica DePaul, our Senior Director of Billing Operations. And our guests today are Doughty, the Chief Financial Officer for HealthNet, and Tracey, Suppa-Todd, the Director of Human Resources for HealthNet. So Brian and Tracey, thanks so much for joining us today. Before we get started with firing away all of our questions for you guys today, why don't you just start us off with a quick background and tell us a little bit about how you got started in EMS and bring us through your journey.
Thanks, Kandi, for having us today. I appreciate that. As you said, my name is Brian Doughty, and I'm the Executive Vice President and CFO of HealthNet Aeromedical Services. My entry into EMS is kind of non-traditional, if you will. I don't have a medical background, which some will agree that that's probably a positive thing. But I spent my time before I joined HealthNet in public accounting. And it just so happened that one of my first clients was a 911 agency. And then HealthNet was also a client of mine. So I kind of ended up here, whether it was meant to be or not, but here I am. And 13 years later, I still love it and enjoy the service that we bring to the community.
Awesome.
So I have also no medical background, but I tell my kids I'm medical adjacent because I've spent a lot of my career in human resources supporting clinicians. I worked over at one of our owner hospital systems at Charleston Area Medical Center here, located at the time mostly in Charleston, West Virginia, and the surrounding area. They've now grown into a huge health system throughout our state, but spent about 20 years there. And back in 2020, HealthNet decided to bring human resources function in-house, posted for a human resources person. So I came over then, and that was my entry into EMS. It's been exciting, to say the least, but definitely sometimes feel like an outsider. Brian and I will kind of look at each other and say, oh, welcome to EMS, but as the non-medical person, but they've made us both feel really welcome.
It's awesome. It's always interesting, I think, to hear how people actually got into the industry. We see that a lot on the RCM side, too. It just has a way of getting in your blood, we like to say. And Monica is with us live today, even though we're seeing her picture. Pittsburgh was hit really hard last night with some pretty bad storms, and she lost power, along with a lot of other people that were praying stay safe, and that power is going to get restored as quickly as possible in Pittsburgh. So Monica, thanks for being with us today, even though we can't see you, but we really appreciate you being here. So first question, we'll start off with an easy one. As EMS leaders, what would you say keeps you up at night?
Coming into this role from the hospital setting, I wasn't really sure what to expect because, like I said, it was an introduction to EMS for me. But as I've gotten to know our crews across the state better and better, I think one of the things that keeps me up at night is just worrying about their safety. They have an incredibly dangerous job. We have flight operations and ground operations, and one accident would be very catastrophic, but on our ground operation, they travel so many miles that the likelihood of an accident is more common. So it's kind of a toss-up of who I worry about more. And on a less heavy note, I also worry a lot about our staffing. We continue to grow in ground operations, and it's just really hard to keep up with that demand.
I echo Tracey's comments. Obviously, safety is always in the forefront of what we do. We're in a very unforgiving industry. Safety is always our top priority. Definitely the patient, but also the crew members on both air and ground transports. That's definitely our top priority. One that I lose sleep sometimes over, just the reimbursement side, the long-term viability, not so much of our organization. Well, that is always on my mind, but more so EMS in general, just with some of the struggles they're facing, not only here in West Virginia, but across the country. Those are always the things that are kind of on my mind. So I think that would be my top two for sure.
We've
So
got
you talked a
some.
little bit about the staff. So this one's for Tracey. How is your leadership team handling shortages in staff? We know that that's an ongoing concern across the EMS industry, and mental health concerns and potential burnout because they are in such a high stress environment.
They definitely are. I think I'd say we have two different situations on our hands here. I mentioned earlier we have both flight and ground operations. Our flight vacancies tend to be really competitive. We usually have more applicants than we have vacancies for those positions, which is a great position to be in. On the other hand, like I said, we can barely keep up with our ground operations and that growth. So we have done some really aggressive recruiting over the last several months. We partnered with a local firm to help us do very targeted social media advertising. And we also paid a lot of attention to our compensation structure. Along those lines, we have built in a schedule for when we do marketplace reviews. And we've made that part of a routine thing. We do it on a schedule to make sure that we're on track. That way, we're not caught off guard and we're not falling far behind where we need to be. We can keep up with things. So that's something we've done as far as for retention. And then when I think about mental health concerns, we've had a couple of different things that we've tried to do. We were able to secure some grant funding from the Higher Education Policy Commission here in our state, and we used some of that money specifically for mental health. We had 3 of our folks here in leadership trained in mental health first aid, and then we were able to offer that course to all of our leadership team. So 100% of them got that done together. And then we offered the course at no cost to any of our employees who wanted to take that course. So that's one way just to kind of lower stigma around mental health issues and bring awareness to the matter as one of the things that we tried to do there. We also have really robust employee assistance program resources that we share with all of our new hires and all of our current employees, making sure our managers know the numbers to call. And then, thinking about burnout, it's a tricky business to manage burnout, but we try to do things like frequent recognition. In the past several years, we've expanded our recognition program. So we do spot recognitions, and then we also do service award recognitions where we recognize years of service or numbers of transports. And then a few years ago, we added another category so that we are recognizing people for doing wonderful things in our areas of focus, like education, safety, service, quality, all of those things that are our guiding principles. We also have a wellness program that addresses both mental wellness and burnout. So it's not a one solution type of situation. You got to really hit it from all different angles, I think.
And I know Monica and I have been a part of some of those award ceremonies. It's so wonderful to see the recognition of the crew and see the interaction. So I appreciate all you do for your crews and allowing us to be a part of that.
Brian, I think this one's for you. It ties back to your comments about EMS leaders. What are your thoughts on industry advocacy and what role should EMS leaders play?
Yeah, that's a good question. And I think more so than ever, EMS leaders need to be advocating not only for the industry, but for our employees. The employees are, as you guys probably know, there's a shortage nationally, and our employees are frankly overtaxed now. So it's hard for them to advocate for themselves. And I think that we as leaders need to look strategically at how we approach caring for those individuals and ensuring that our operations are sustainable. I like being a part of that here and advocating in Washington, D.C. for our teams and our industry and working together with other industry leaders and having one voice is really important, I think, for the time period that we're in right now in the EMS world.
It's encouraging to see more collaboration starting to happen. And As you indicated earlier, Brian, there's a lot of things that I think keep all of us up at night. It really is going to take all of us working together. So again, just thanks for sharing and letting us come into your day today and ask you these questions. Next up, I think this one may also be for you, Tracey. What would you say are critical characteristics to an effective and successful leadership team?
I have lots of thoughts about that. We really invest in our leaders here. Our leaders need to have, first of all, courage. It's a tough job in several different ways. So whether that means being able to participate in some of the frontline activities and being courageous in that, or simply addressing issues that might be uncomfortable to address, definitely takes courage. Also, we want them to be competent, resilient. Of course, flexibility and adaptability are important. And being able to hold people accountable, themselves and others, being compassionate, open to learning. And I think probably most of all in this business, I've found that you need to have a good sense of humor and not be afraid to sort of allow your teams to blow off a little bit of steam with maybe a little darker humor than what I was accustomed to in my other jobs. It's, appropriate, but it's necessary, I think.
All right. So let's talk about Brian's favorite topic, No Surprise Act, the NSA. When we're 3 years in, which just seems crazy, right? Have the NSA for the last 3 years. How has that impacted your operation? Good, bad, all the above?
That's a really good question. I think there's positives and negatives to the NSA. I think the positive that I can think of right off the top of my head would be, from a patient perspective, not being surprised by a large aeromedical bill. I think one of the negatives to that has to do with the fact that that's a misconception sometimes that, there's not always a large helicopter bill, but that's kind of what got us to where we're at now with the NSA. I do have some concerns with not so much the NSA itself. I think as an industry, we were supportive of that initially. I think more of my concerns have to do with the follow through of the payers, and there's no real mechanism to hold them accountable at this point. I don't know any other business that you provide a service for and then told that, oh, it's not worth X, we're giving you Y instead, which Y is always a lower number. So that's a challenge, and I do feel like we're making some positive progress on identifying those issues and correcting them. I'm hopeful that before we go down that same rabbit hole on the ground side, that we're able to address those issues legislatively and we're able to have some accountability. One of the biggest fears that I have is on the ground transport side or the 911 side, seeing the negative impacts that an NSA type law would have, because there are times where you're waiting a year to get paid for something. And I think that some of the agencies that don't have the financial backing of a government or municipality, whatever it might be, they're not going to be able to keep their doors open. And I think that is where there's issues with providing a service. If those agencies have to close their doors, you're not going to have service. And whenever you dial 911, that should not be a concern of getting an ambulance. Like I said, we could talk for many hours about NSA, but I think that to sum it up, there has to be some accountability. The payers need to pay based on the law within the timelines, or else face a penalty that, again, there's nobody there to enforce. So I think that as long as we as an industry continue working towards addressing those, I think that we'll see some improvement there. I do think cost reporting is a good tool. I think we could finally prove that Medicare reimbursements, for instance, or Medicaid reimbursements aren't covering our costs. So I think there's another positive to the NSA that I think that'd be helpful. But that was a lot in a short period of time, but those are some of my positives and negatives as it relates to NSA. Kind of interested, Stephenie, if you think that you have some of those same concerns or if yours vary a little bit.
Definitely the same concerns. It's a very time intensive process. And what we're finding is even in that open negotiation, making sure that those payers are acting in good faith. You know, you mentioned a very small payment up front that drives that process. You know, really identifying those payers, working collectively as an industry. I think you've led that in several of the associations and having those conversations with the legislators of, you know, we're not asking for a high reimbursement. We're asking for a fair reimbursement for the level of service that these dedicated individuals are providing and the cost associated with providing that care. You know, really looking at how are the payers responding in that open negotiation period. And when we don't get a response at all, what are those next steps that our teams are having to do and work collectively with you to go to that next stage with the independent dispute resolution? The hope of NSA that then payers would come to the table and have those conversations about a potential in-network agreement or a fair market value for those services. And we're just not seeing that on the payer side. We're seeing it with some. I won't put them all with a broad brush, but I really feel like there are certain payers that really just are not open to that negotiation standpoint.
Yeah, and I totally agree with that. The crews, and they're highly trained and skilled, and I mean, frankly, it's sometimes a slap to their face that these payers that can't see the broad picture, if you will, doesn't respect or understand the level of service that they're bringing to the field, whether it's on the side of an interstate or at a small rural critical access hospital that doesn't have the ability to offer the level of service they need. These crews are bringing that to them in the field. So that's a frustrating piece for me is I see the ECMO transports and I see us going to the critical access hospitals and delivering people to a higher level of care, and to get that initial payment of, you know, a fraction, literally a fraction of the cost to provide that transport. It's very degrading.
When we talk a lot too about, you know, we still have to pay them what they're worth too. So where does it all come from and how does it all work together if we can't get the money we need to support them?
To Tracey's point, we have to remain competitive. If you have seen what's happened in the industry, not just the aeromedical or the ground ambulance, but in the healthcare world in general, with the increase in staffing costs, I mean, that affects us too. And that's impactful to us. Waiting so long for a payment for a service that you provided just doesn't add up. You know, it just doesn't make a lot of sense to me.
There is this shared sense across the industry right now, this fear on what's going to happen on the ground side. And we're starting to see different programs go into place in states. We're seeing a lot of variations. And we have a team right now that's looking at implementation and studying the different regs per state. And we are going to be doing a podcast on that soon. I wish that I could say it's going to make it crystal clear to everyone, but it has been quite confusing. And just like NSA, there's so many good intentions of the law. It's just how do you implement when there's no remedy to reinforce it? We're trying to lead on that front on what we're seeing from the reimbursement side and what payers are not following the regs and how we course correct when we see that.
Yeah, Kandi, I think, you know, my final comment on this would be that I hope that we as an industry can address all the issues and correct them prior to an implementation of the NSA on the ground side. Based on what I have seen, the extended time period of payments, even within network providers, would be detrimental to the ground ambulance industry across the country. And that's my fear.
Yeah. Monica, you got a question out there?
I do. Tracey, how do you build a culture that keeps people motivated in such a high stress environment?
Do we do that? Some of the things that I think are really important to our organization, sometimes we even jokingly say, like maybe to a fault, is that we have a really high level of transparency here. When you're acting in such a dangerous role, you do not want to feel like there are people in leadership who know things about your vehicles or different protocols or things that they're not sharing with you. We put it all out there so that they know that they can trust their leaders. From a human resources perspective, nearly every single thing that my department does every day does that with the idea that we make things easier for the people who are in those frontline roles. I've always been in the healthcare adjacent side of things and say that even though I don't take care of patients, I take care of people who do take care of patients. Mm-hmm. So what that means is it's evaluating, making sure they're paid fairly and competitively. It means choosing benefit packages that will support their well-being and allow them to take care of their families so that when they're here, they're not worrying about not being able to provide good care for their families from a healthcare perspective. Thinking about when we have unique kinds of things that we come up with. We do a lot of financial wellness. Finances tend to cause a lot of personal stress that pulls over into the workplace and pulls focus from work. So we've implemented a few different programs and partnered with financial advisors, and we've implemented an earned wage, like an early access to your wages program to help people manage better when they have a crisis like car problems or their refrigerator went out, things like that. All of those things that we can do to take care of our people, show compassion and listen to their suggestions and feedback and answer their questions honestly. I feel like all of that helps build a culture where people feel motivated because they feel respected and they feel valued.
A lot of times, I think as an industry, we talk a lot about what's wrong, what's not working well. But what is something EMS leaders can do better?
I'll go first. So I actually had the honor of presenting at a leadership session yesterday in our state. And I think that causes me to just have that top of mind thinking about investing in ourselves as leaders. There are always new things to learn or new things to consider, whether that's thinking about different generations in the workplace and how they want to be managed. So all of those new things that you might learn, but also taking good care of ourselves, setting boundaries and paying attention to our own mental health concerns or stress and burnout so we can be good role models for people.
Good advice.
I think Tracey hit the nail on the head on that one. I think I would just add listen, just observe, listen, and do better.
All right, Stephenie, I'm going to ask you a question now. We've talked a lot on some emerging technologies on the RCM side. Everybody likes to talk about AI efficiencies and data analytics. It's an exciting time from that standpoint to be in this industry. What are some things that you're most excited about from that front?
As you look at AI, right,
and you only have 5 minutes now.
I know, I was going to say.
It's kind of like NSA for you.
Talk about NSA. I'm a data geek. I'm a self-proclaimed data geek. So the business insights and how we can use technology to help drive some of those, while technology can help us drive some of that, it still takes a very dedicated and experienced resource to help in that process. Like we have our analytic tool that we use within in Quick Med Claims, and it helps drive the conversation. It doesn't solve the problem. So if there is something that's identified, it can help with a trend. It can look at my average payments for, this, and they're down slightly. Well, AI can help me go, oh, it's this payer A, payer B, but I still need that insight and revenue cycle expert to help determine what happened. What I love is also driving potentially some behavior. There's some AI and rules that we can put within the patient care record. Just a reminder, have you documented all of your assessments? What are those things that technology can help us in actually driving better outcomes for our patients, better outcomes in our revenue cycle? So giving those from an insights perspective, I think that's really what I'm most excited about as a data geek.
All right. Monica?
What does partnership mean to you, and how important is it in running a successful operation?
I think partnerships in general are very important. I think it's suffice it to say that the HealthNet wouldn't be where it's at today if it wasn't for our owner health systems. WVU Medicine, Vandalia Health, and Marshall Health invested mightily in our operation over 40 years, and they continue to do so, and they continue to make investments that move us forward and put us in the safest technology, safest aircraft out there. I also think that partnerships, whether it be with folks like QMC or Air Methods or Airbus helicopters, I think for me, I'm speaking personally, I have a sense of calmness knowing that the partnership that QMC and HealthNet's built over the last 13 years. If you notice I didn't mention in my earlier question about what keeps me up at night. I know that our revenue cycle management is in good hands, and we talk daily. Likewise with Air Methods, I know that given their huge presence in the market, they bring a lot of value to the folks that like to focus on healthcare. That's why we've been a partner of theirs for 40 years. I do sleep better at night knowing that our crews are in good hands. We have great maintainers, great pilots, some of the best in the industry as far as I'm concerned. It's hard to build a successful organization without strong partnerships. And, we have many partnerships here.
I was going to say, one of the things that we emphasize is this concept of one team. We say that a lot. And when we say that, we mean everything from QMC to Air Methods to our communicators who actually are employed by the hospital systems.
Love that.
Could not do this business without all of those pieces. And something Brian said about our partnership with QMC made me remember something that was really cool for me at one of our award banquets a couple of years ago. It was after the dinner and we were all kind of sitting around. I want to say it was Stephenie, but maybe it wasn't. But one of our friends from QMC remarked to one of our crew members, like, "You're the good charter." And I was like, oh my gosh, they know our people. That's amazing. Just that personal connection. She was just like, wow, okay. I thought that was really special that our partnership is close enough that you would recognize someone's name and know the type of work that they do.
That's awesome. I love that. Love it. Okay, my last question for today, and Brian, I think this one's going to be for you. So, of all of your time so far in EMS, what would you say has been your most memorable moment?
I think about the industry often and where I was when I came in as a newbie. I think Tracey kind of alluded to it earlier. We're two of the outcasts because we didn't grow up in EMS. I think, probably one of the more memorable moments was, I don't think, if you're not in this industry, it's hard to understand exactly what our crews do and the sense of pride that they have in what they do. But as kind of a more generic way to answer that question, I think that just knowing that when that light bulb went off after I was here for so long and understood the pride that these folks have and the willpower to do what they can to, save somebody's life, and just seeing that sense of purpose of the one team philosophy would probably be one. And I know that's more of a generic, not an exact, like, here's a patient that, really made me realize that I was in this for the right reasons. But EMS kind of has a way of sucking you in. And when you you see that helicopter fly over, or an ambulance. In our case, our largest operation for a ground ambulance is here in Charleston. But when you're in the car with your kids and they say, "Oh, there goes your ambulance," or "There goes a helicopter flying over," and just seeing like their reaction as a kid, and then knowing like what's happening in that aircraft or the patient they're delivering home from a discharge, like it's just kind of brings it full circle. And I know that's, I don't want to sound sappy or anything like that, but just the what these people do, they risk their life to go in a helicopter to save somebody else's life. I mean, that's pretty remarkable, really,
It really is. You feel so proud to work for the organization. Like Brian said about seeing the ambulance, I was in Morgantown yesterday and we have a base there, and I was with my daughter. She goes to school there and saw a helicopter fly over, and I'm like, there's my friends. And, I do that here in town. We're all over the state. So no matter where you go, you might see your friends in the air. I had a funny story where I was wearing a HealthNet t-shirt and I was checking out at a cash register with the cashier. She said, "Oh, you work for HealthNet?" And I was like, "Yeah." And she's like, "Do you fly? Are you like a nurse in the helicopter?" I'm like, "Actually, I'm their HR person." And she goes, "Oh." I go, "It's still cool." Because it is cool to get the opportunity to work alongside them is cool, even if I'm not in the helicopter.
Yep. Awesome.
So I'll add on to that for my last question. So we talked about some of those things about EMS. What does this future look like for EMS?
I think it's kind of a loaded question as well, because based on some of the stuff we already talked about, some might say bleak, but I think there's a lot of positive in the industry right now, and I think that where we're heading is in the right direction. I've never seen an industry more lockstep in where they want to go. There'll be some tough days before it gets better, and I can only speak for what we're trying to do here in West Virginia. I'm sure every state is doing some of the same things that we're doing, so I think it's probably a common theme as we kind of start growing some of the younger folks in the high school rankings and get them to understand that it's okay being an EMT or paramedic. You don't have to go to college. That's totally fine. I think as long as we continue the training and the education piece and exposing high schoolers to this industry, I mean, what's cooler than saying, "Hey, you can fly on a helicopter one day"? I see the future looking bright as long as we continue the trajectory that we're heading right now and trying to right some of the wrongs that have happened in the past, if you will, and being reputable. I think it's positive. And I'd be remiss if I didn't say that, we got a new medical director a couple years ago, and 18 months ago or so. Dr. Humphreys has really brought an innovative way of thinking from a patient delivery standpoint, whether we're looking at ultrasound in the field or whole blood. We've carried blood on our helicopters for many, many years, dating back to the 15 years at least. But there's just new and innovative ways of trying to keep up with the industry. And I think that part of what we're looking at is positive, especially given the struggles that some of the smaller hospitals are having, staying viable in their communities. So that's a piece that I would add as well.
And before Monica rounds us out here with our final question, I just want to say, I think it's been apparent through a lot of your answers today that you guys are doing a lot of things to impact that future. Sometimes it is so easy to get into that just rut of what's difficult, what's been difficult, why it shouldn't be this way, and really not spend as much time as we should or focus on, well, how can we change it and how are we working better together to change it? Because it does take all of us. One team, I love that concept. So I'll turn it over to Monica now to round us out, but just thanks so much, guys, for sharing today and spending your time with us.
Thanks for having us.
Well, for the final question, during this special week celebrating EMS, what are some things that you and your teams will be doing to make that happen?
Tracey, I'll let you go first. Then
All right. We're really excited to be celebrating a huge milestone anniversary this year. at HealthNet. So similar to how you see Mickey Mouse do it, we're going to be celebrating our 40th anniversary for like 18 months.
Woohoo!
That's a big deal. And
Big deal.
so being able to, the folks that we have working with us now, being able to say they're part of an organization that's been making a difference across the state for that long, that's definitely something we'll be celebrating. And I don't want to steal Brian's thunder, but he came up with a really cool idea for us to be able to recognize our employees. It can be challenging because they're everywhere, but one of the things that they always ask for is more swag because they are proud. We were able to work through a contact Brian had to allow our team members to get some HealthNet swag as part of a small gift of appreciation during this week. So we're celebrating
Very
new
cool.
swag too.
Yeah, Tracy's right that they're excited about that, and it was definitely a team effort. But I think one of the biggest things that we would celebrate is just them successfully caring for patients safely in an unforgiving environment, honoring the folks that laid the foundation before them, and building on the ones that are still left who'll carry the tradition on. I hope they all know that whether they're here at HealthNet or Health Team or anywhere across the country, the service that they give to their fellow man, it doesn't go unnoticed and is utmost appreciated.
Well said. We really appreciate what you guys do day in, day out, and all of those behind the scenes at both of our organizations to make this partnership a success. So thank you, and hope you guys have a great day.